Hi everyone, my name is Andrew Henry and I'm the Health Commissioner for the Jefferson County General Health District. We know you have been hearing a lot about the COVID-19 pandemic for nearly 2 years. Whether it's community spread, mitigation strategies such as masks and social distancing, access to testing, vaccines, and now boosters, we recognize that a majority of you are tired of the old narrative. We are too, but we cannot simply push it away. It's our job to guide you. It's your job to ultimately decide your path. That being said, freedom of choice is not freedom from consequences. Vaccination is certainly important for all diseases. It's undeniable, but it's not the only factor in fighting the pandemic. We cannot depend on a vaccine alone to be our only line of defense. The checklist for optimal health is long, and we cannot simply stop after addressing one of those tasks. I am reminded of when the vaccine first became available in early 2021. We often received calls from residents trying to justify their spot in line for the vaccine based on certain health issues. Accordingly, the vaccine was rolled out to protect healthcare and EMS workers, followed by the elderly, and then those with underlying conditions. Those with health issues were prioritized. Now we need you to start prioritizing yourself. So what can you do for your health? This includes proper nutrition, taking vitamins and minerals, exercising and maintaining a healthy weight, quitting smoking, alcohol in moderation, adequate sleep, and practicing good hygiene. One additional important step to improving your health is establishing a relationship with a primary care physician. An annual visit to a primary care physician is vital to staying up to date on your important health screenings. Additionally, they can get you access to testing treatments such as monoclonal antibodies and antiviral drugs that you are otherwise left to seek emergency care for. And this is also putting an unnecessary strain on the healthcare system. While we often hear of people who do not have a primary care physician, the number of people without a PCP during the pandemic has become even more apparent. Primary care is also important to help you decide when and where to access testing. If you are mildly symptomatic and you can call your PCP for a COVID-19 test order, that will allow you to get quick access to testing. If it is a severe case that you need to seek medical attention immediately, please go to your nearest emergency room. But otherwise, that's where the important relationship with your PCP comes into play. At this time, COVID-19 antibody drugs from Regeneron and Eli Lilly should no longer be used as they have been deemed ineffective by U.S. healthcare officials. This announcement was made on Monday, January 24th. Healthcare providers have alternate therapies to battle early stages of COVID-19, including 2 new antiviral pills from Pfizer and Merck. However, both are in short supply. COVID-19 contact tracing has become even more challenging than in the past. Many health departments, including us in Jefferson County, use the Public Consulting Group, or PCG, for contact tracing. As cases rapidly increase simultaneously throughout the state, it creates difficulty for PCG to keep up. Moreover, the new isolation and quarantine guidelines have made contact tracing less effective. For example, a 5-day quarantine for a close contact who is either unvaccinated or not boosted is a failed effort when that person is not notified until day 3 or 4. We want people to know that you have not been intentionally left to your own devices. If you test positive, it is unrealistic to immediately expect a call. Don't panic. Stay home for at least 5 days and then wear a mask for days 6 through 10. It's really not a difficult concept, so let's not make it harder than it needs to be. I will go back to the quarantine example. Staying up to date on your vaccination status impacts the level to which you will need to quarantine. If you are eligible for a booster, we highly encourage you to call the health department for scheduling or go to your nearest retail pharmacy that offers the vaccine. One of the questions we often get, especially that come to us through our email system, is, I've tested positive for COVID-19, what do I do? First and foremost, if you've tested positive, you must stay home for a period of 5 days. If you have not received a call within a certain time frame, please feel free to either call us or send us an email and we will issue you your isolation paperwork for your employer. A frequently asked question we receive on social media often pertains to the hospitalizations and correlating health issues about the hospitalized patients we have here in Jefferson County. What I can tell you is that the hospitals share vaccination status with us for their hospitalized patients, and no other health information is shared with us at this time. We at the Jefferson County Health Department have a number of programs that we must re-engage in 2022. We have seen a number of health issues put on the back burner for far too long. Our goal is to highlight these health programs going forward each month. Still, we must be committed to providing the community with the vital information that they feel is necessary about the constantly evolving COVID-19 pandemic.